Hello, and we are live. Welcome to iTunes for Tourettes. My name is Shane. Jackie.
You're frozen. Sorry. My name is Jackie.
And I'm Corey.
And tonight we are talking about doctors and Tourette Syndrome. We have a lot of different experiences with doctors being neuro nutcases. At least that's what I can call myself. I'm not putting that on you two. So how many doctors do you guys think you've seen from the point of your tics starting? Oh my gosh, what is happening? What is happening? I'm sorry.
Are you listening to yourself? You got a little
No,
bit
the
of a
Hangout was
feedback
open
there?
in a separate video. That's very embarrassing. Okay, so my question was, how many doctors have you seen from the point of your tics starting and the point of you finally being diagnosed and treated, because you might have gotten diagnosed and went to someone else for treatment?
Jackie, you want to start?
Sure, I'll start. So I started showing tics at 3, but no one knew what they were really. So I I don't really remember if my parents took me to doctors at 3, or just kind of ignored it and thought it would go away. But I definitely know at 5 I was taken to a lot of allergists because I had a sniffing tic. So I think I saw about 2 or 3 allergists, and they said I could possibly be allergic to dust mites. But it was later proven that I wasn't allergic to dust mites. So they kind of said, oh, she might be allergic to dust mites, so we'll ignore it. And I think I saw a few more allergists, and then at one point I saw a doctor who stuck a long tube down my nose, and that wasn't very pleasant.
Was that an ENT?
Yeah, an ENT. Took pictures of my adenoids because of the sniffing. And yeah, they didn't come up with much, obviously, because there's really nothing wrong with my adenoids or anything. Then I had like a CAT scan of my sinuses because they thought, oh, maybe we'll get a better picture of the adenoids that way. Again, didn't show anything, obviously. They said, yeah, there's nothing really here, maybe a slight deviated septum, but really nothing that would be causing this. So
That's how I found out I have a deviated septum. It's because we were getting pictures done for my Tourette stuff. And
yeah.
I looked at my MRI and I'm like, there's like this curve.
Yeah, so that was basically my experience with doctors when I was younger. I could go on. I don't know. Does anyone else want to talk about other doctor experiences?
How about Corey?
Okay, so where do I start?
Oh, this
So
sounds like it's going to be a good one.
How much time do we have? So I
I
started
originally said
showing.
this was going to be an hour long, but we never know.
So I started showing symptoms around, yeah, 7th grade. One morning I woke up and it was this. My head was shaking. I couldn't control it. Everyone was worried. Parents were worried. Now I have some neck problems, but I don't really have that neck tic as much anymore. But anyways, so my parents brought me to my family doctor, who told my parents to take me to a psychiatrist and a neurologist. He talked to my parents and said the psychiatrist is because he thinks I'm doing it for attention, and the neurologist is just in case. So we went to my parents believed me and did not take me to the psychiatrist. No, I'm not faking none of that. But went to the neurologist, who basically told me to my face, "You're doing it for attention." And
Really?
he was the first of many neurologists to do that. So I've ended up going to psychiatrist, neurologist, therapist, couple general physicians, cardiologist, because they ended up prescribing me a blood pressure medication, which then caused my blood pressure to go all over the place. They tried to put me on Haldol, all sorts of stuff. Nothing worked, period. I think it was about 2 years later, I finally found a different neurologist, Dr. Britton. I went to him, and he officially diagnosed me with Tourette Syndrome.
Wow. How old were you?
That was ninth grade, so right around 13 or 14-ish. Then my tics changed to my hands, so it's usually more like that.
Do you have any ASL tics?
Actually, no. ASL is luckily enough how I control it. But every once in a while I'm interpreting, I'll have to just stop and I stretch.
I have ASL tics. My deaf teachers learned to ignore them. I guess I have a certain affect about my face when I'm doing ASL tics, and they know I'm not actually saying anything.
Speaking of ASL, sorry, but I'm going off on a little bit of a tangent, but there was an article about a deaf person with Tourette's, and he has coprolalia. He has to fingerspell the swear words. And it's just a little bit of proof that it's not the vocal cord that's doing it, but there's a part in the brain where the swear words are located.
But you also have to understand that coprolalia does not mean swear words. Coprolalia means anything that is culturally unacceptable for the environment you are in.
Yep.
Well,
that could even mean like, I don't know, like booby smashing or something.
Well, then there's the separation technically of, some people make this differentiation of between coprolalia and copropraxia.
I have both. Big time.
Yeah. So then I guess like copropraxia is inappropriate gestures.
But like, I consider my tick hugs to be copropraxia. I consider them socially unacceptable or improper tics and involuntary unsociable things. I mean, most of the people really like them, but like I consider it inappropriate, and that is copropraxia. Even a kid saying fart, that would be considered coprolalia.
I may have to go for a little bit. Can I jump back in on the broadcast?
Definitely, please.
Okay. I will jump back in a few minutes, all right?
Awesome.
Okay. Do I just say leave the call and then I come back?
Yeah, you just hang up.
Okay. I'll come back. Okay, thanks.
So, sorry, everybody. We're trying to get used to Google Hangout.
Yes, Google Hangout. Beloved. So for me, my tics, we thought my tics started when I was 18. That's when they first became really noticeable. They just exploded out of nowhere. But ever since, I have been able to look at some home videos from when I was growing up. Actually, a lot of them have been lost, but I have noticed tics, motor tics, in those videos, specifically my head scratching ones, my face touching ones, and I had one where I'm like this, in like 1997. I was 7 years old. So most of the motor tics that I've noticed in the home videos, which aren't a lot, started when I was around 7. But for the most part, for me, Tourette started when I was 18. And it came out of nowhere. It was a surprise, and it was rather traumatic. And we went to, my dad called a psychiatrist first, saying, like, what's going on? And she told him over the phone that she thought it was conversion disorder. But this is going on more than 5 years, and it hasn't gone away. And I have gone to numerous professionals who have said it is not conversion disorder. I've seen 1, 2, 3, 4 psychiatrists. three, four neurologists, a few psychologists, numerous counselors,
Were you
and
ever hospitalized too?
yeah, I'm just not willing to talk about that on the air.
Sorry.
It's okay. Yeah, just I've seen a lot of people, and the only persons that brought up the whole like I'm doing it on purpose thing again were this one particular psychiatrist and neurologist who um, did very poorly in their care of me, in my opinion. They
Hmm.
didn't take their notes well. I had been told by my counselor that some of the things that were written down about me weren't true and weren't things that I would have said,
Hmm.
and just things weren't done well. It was really hard and hurtful to go through that experience, but now I'm with a great neurologist again. I'm back with the original practice that had taken on my movement disorders, and I'm very pleased. I wish there could be more done and sooner, but this is
Hmm.
what it is. I haven't I think I did try medication at first, but ever since I was able to accept my tics, I haven't really pursued medication for them. And medication didn't really even help. Ritalin helped for a while, but now if I take Ritalin, I get a rebound effect where, yes, my tics will subside for a while, but the second Ritalin wears off, they come back with a vengeance, and it's not even worth it. It just
Yeah.
isn't.
Same as if you're holding it back.
No, I'm not even holding it back. Ritalin literally calms me. It can put me to sleep. I'm one of those weird people. But yeah, now I get this rebound effect, whereas in the past I didn't, and
Hmm.
it's just not worth it anymore.
I hear you. I was part of my Tourette's. I was hospitalized for I think 1 day or 2 days. That was specifically for the Tourette's. Then, because of what the doctors and everyone said, that caused depression and suicidal thoughts. So I was hospitalized for about a week for that. Now I am on nothing directly for the Tourette's, but it kind of helps in a roundabout way. I'm on Flexerol, which is a muscle relaxer. That's more for the pain and the
Yeah,
damage. I'm
your
on,
neck tic that you were talking about, those neck tics are very painful. That for the first few days they might just seem like small movements, but it
but
really builds up. After a week, you're in such pain. I hated
after
those.
2 years, I've got some kind of damage. So that's why last night I had the corn bag. It was nice and warm, felt good.
Ah,
I also take Xanax for when my tics get really bad. It kind of it's usually for the anxiety because the anxiety will cause the tics, which causes the anxiety, which causes the tics. That kind of stops that. Almost puts me to sleep sometimes.
I can
And
imagine.
yeah, yeah, those are the major two.
I found in my experience that the family practitioners really don't know that much about Tourette. Basically, when my vocal tics and everything started, we went to my family practitioner, and she went to a book
Yep.
and she like Xerox copied this page about Tourette syndrome, and she brought it back in, and she's like, well, I mean, you meet all of the criteria. And this book, it wasn't even like the DSM or anything. It wasn't even a physician's desk reference. It
It
was
was
just,
just some random.
it almost looked like a textbook, but not like, I don't know. But yeah, she just like Xerox copied it and handed it to me, and it was like, well, I guess. And she referred me to a general neurologist who really mostly just deals with migraines and seizures. And I didn't find that neurologist to be very helpful. The neurologist thought that I was on some vendetta to have a lawsuit against somebody, I don't know, because at the time we thought maybe a medication had triggered the Tourette symptoms. Anyway, so that neurologist I didn't find to be very helpful. So I demanded a referral to the Movement Disorders Center, and she did. And that Movement Disorder Center has been the best choice I have ever made. They deliver the best care, and if you get a fellow, then your care is overseen not only by your own neurologist, who's a fellow, but also by their boss. So it's like you get 2 layers of care, and it's very, very, very thorough. Are you guys still there?
Yeah.
Okay. How about you, Jackie, with neurologists?
Okay. Let's see. Oh, we lost.
We lost Corey. He'll
We
be
lost?
back.
Okay. So, let's see. So I wasn't diagnosed till I was 16, because we just kind of, well, no one recommended that we see a neurologist, because they really didn't know anything about it. I just kept getting bounced from allergist to allergist, and
So you got stuck in the whole allergist loop that some kids
yeah,
get stuck in.
I got stuck in the allergist loop cycle, and then finally when I I would be telling my pediatrician about it, and I had this like swallowing tic where I had to like swallow over and over again, and I was telling my pediatrician about it, because it got to a point where it was really, really bad, and it was causing me a lot of stomach pain because I was swallowing a lot of air. So it would get all in my stomach and cause a lot of pain. And I was telling my pediatrician about it, and she really didn't know what to think of it. She gave me a strep test, and then the strep test came back negative.
Obviously.
Obviously. And then I said, well, what am I supposed to do about this? What could it be? And she says, it's probably psychological, and you just have to stop focusing on the swallowing, and then it'll go away.
How come that always seems to be the answer? Like when they can't physically diagnose something with a test, it must be psychological. I don't get that. It's frustrating.
Yeah, so I went on a more time. That was probably when I was 15. And so I went on some more time. And then finally, I was seeing a psychologist at the time for my OCD, because I had already been diagnosed with OCD at that point. And she finally recognized the symptoms as possibly Tourette's, and she was the one who finally recommended I see a neurologist. So it took a long time, but when I was 16, I finally went to a neurologist, and I got really, really lucky because the neurologist I was seeing, that I had an appointment to see, 50% of his patients are Tourette's patients, and he specializes pretty much solely in Tourette's. He does some other, stuff, but his real specialty is Tourette's. So he diagnosed me within the first 15 minutes of the visit, and I basically just told him my history and what had been going on, and he was like, well, you've got Tourette's. And it was pretty basic from there.
Basic.
It took a long time to get there, but yeah. Oh, hang on a second.
No problem.
Hello?
I guess I'm by myself.
Hi, I'm back.
Are you back? Welcome
Yeah.
back. So you were diagnosed by a specialist. And did you say that this neurologist had Tourette syndrome himself?
This one does not actually. His colleague does so, but the one that I see does not. But I work closely with his colleague, who also I live next to a really good medical school. The medical school right now is in the process of being certified as a center of excellence with the TSA.
Awesome.
So
Yes, they're
I
getting
got
that.
really lucky. They have two neurologists there who specialize in it. One of them has Tourette's, but I don't see that neurologist. I work with that neurologist very closely in the lab that I work in, but he's not my doctor specifically.
I feel like more people with Tourette's should become neurologists.
Yeah, or go into the field of studying it in general, like a neuropsychologist or something like that.
I'm so mixed on the neuropsychiatry front because I don't feel that they've decided what separates a psychological condition from a neurological condition, and there's so many gray areas.
Oh yeah, definitely.
It's very
Definitely.
frustrating. I almost feel as though Tourette syndrome, I almost feel like everybody has Tourette syndrome. Everybody has a habit, but it's us who have it more often, frequently, or it hurts us, that it becomes this disorder and syndrome that is diagnosable and, well, it's not really treatable. Getting there. There are some treatments for it. And it's almost just a difference. It's just a difference. It's like the difference between being tall or short, having tics or not having tics.
Yeah, I totally get that, and it's a lot more common than people think. A lot of I've been doing this research study. I was telling you a little bit about it yesterday, um, but I've been doing this research study, and it's on Tourette's, obviously. And some people would ask me like, "Oh, what have you been studying? What has your research study been on?" And I would say, "Oh, it's a study on Tourette syndrome, and we've been studying hypersensitivity." And I tell them about it, and they say, "Well, how did you get your subjects? How did you get people to participate in the study?" I said, "Well, we have the patients in the lab, and like, do you have enough of them? How do you have that many of them?" Like, they're so surprised that
Just
there would be
prove
anyone
it.
out there with it that I would be able to recruit for my study. And I just think there's this perception that it is people think it's so uncommon, so rare, so infrequent, and that's not true. It's actually a lot more common than people think.
What is your major, or is this research study an elective?
My major is philosophy, neuroscience, psychology.
Okay.
Um, And I'm in a program called Mind Brain Behavior. And so for the first year of that program, you attend lectures that are focused on mind, brain, and behavior. And then the second year is independent research. So I spent all year doing independent research. And then at the end, you present at a research symposium. And
Wow.
I ran the study, I recruited, I analyzed the data, and then I created a poster and presented it at the symposium. And
So this
then,
is a scientific thing for you, not a pre-med?
yeah, I'm not pre-med. Um, I'm hoping to get my PhD in this.
You look like a PhD person.
Really?
Yes.
Okay. Is that a good thing?
Yeah.
Good.
I wonder why it's so uncommon for family practitioners to be fluent in Tourette syndrome. I mean, there are a lot of disorders and medical disorders out there, and obviously a family practitioner can't be expected to be an expert in all of them. But I would think that for someone who works with children, that Tourette syndrome should be at least recognizable.
Especially since so many kids have periods in their life where they have tics. Um,
Transient, transient tic
Transient tics.
disorder.
Um, I can't remember the statistic, but there's a large percentage of children who have one tick or two ticks throughout their childhood, or for a period of a couple weeks in their childhood or a couple months. And I think it should be something that pediatricians know about so they can say, oh, this is transient, or oh, it probably won't continue. But if it does, then knowing what to what advice to give and what specialist to recommend from there.
Yeah. I feel like we have to see so many specialists just to get not only a diagnosis, but just like answers even. I've had so many MRIs and blood tests and tests that I don't even want to talk about.
Yeah.
So many to rule out all of these other neurological conditions. And these neurological conditions that they try to rule out, while yes, I am relieved that I don't have those conditions because those would be very bad. Um, my complex vocal tics that I'm having in no way represents chorea. It doesn't represent Wilson's disease or Huntington's disease because those diseases do not have complex vocal tics.
Yeah.
You just don't. I mean, if I was only having motor tics, and I do have motor tics, and it is possible to have one of those other diseases with Tourette syndrome, but honestly, like, I wouldn't say, oh, complex vocal tics, we need to rule out Wilson's. Like, no.
Yeah.
They don't match at all.
Yeah, no, not at all.
If anything, I'd maybe check for a seizure. I was supposed to get an EEG and I didn't get it, but I mean, they didn't even like offer the EEG for tics. It was for something else. It was just like, really, blood tests for vocal tics.
Yeah. I was lucky I didn't have to go through any of that. I didn't need any other tests to rule out anything else because my neurologist was so confident that this was what it was. I didn't need like a EEG or MRI or anything like that. But before I was diagnosed, of course, I had a lot of
He didn't
unnecessary
give you an
tests.
MRI to rule out brain tumors and lesions?
No, I had no MRI.
Oh.
I've had an MRI since, so I know actually that I'm clean because I participated in a study in my lab that was an adults with TS study. And you know that I work in the lab and have TS. A lot of them are always asking me, "Oh, will you participate in this study or that study?" And so I've had an MRI. And there's no brain tumor in there or anything like that. But yeah, I didn't need any other tests to rule out anything else, according to my neurologist when I first saw him. But
I
then,
get
yeah.
MRIs like every 2 years, and like that's just how it's been. I've gotten an MRI every 2 years ever since my tics became clinically significant. And I mean, it usually comes back pretty clear. There are some discrepancies, but nothing critical. I just always find it comforting to know that there's not a brain tumor growing in there.
Yeah.
Like for however much the MRI costs, it's worth it just to know that nothing started growing in there.
Yeah. Yeah, when I did my MRI, I got a picture of my brain afterwards. I still have it lying around somewhere. But yeah, I looked at it and there was no large white spot. Nothing
Yeah.
like that.
Well,
Maybe
I have a
what
lot of
I'm
white
now.
spots.
What?
My brain kind of lights up like a little Christmas tree.
Oh,
But
really?
yeah, like it's nothing fatal. It's just, I don't know. Somebody took a magic marker in my brain, some sort of a gremlin, climbed in through my ear and just started drawing.
Yeah.
I'm weird. So Corey texted me saying his internet crashed.
Oh, okay.
So when we exhaust this topic, we can just end the broadcast.
Yeah. The only other thing I think might be worth talking about is like experience with psychologists, or should that be a separate broadcast?
Oh, we can talk about that. I think you dropped out when I was talking about my experience. I think I said I had met with over time. I've met with 4 different psychiatrists and well, 4, maybe 5. Okay, so I've lost count of the psychiatrists. Most of them confirmed with certainty that my tics had nothing to do with my psychological well-being. Yes, my tics do increase when I'm either relaxed or excited, maybe anxious, but that is normal across all Tourette syndrome patients. That
Yes.
is not that's not a psychological condition. That's just a little bit of extra electricity in my brain for a short period of time. So yeah, they've said, my psychological well-being has no weight on my tics, that it's not a psychological condition. There have been psychiatrists who try to push that on me, but it's been ruled out. It really has been ruled out. I do have problems, but those problems aren't causing the tics. I also had a grandmother who ticked, and she had face touching type tics, and she had one vocal tic that I cannot even mimic. That's how I know it's a tic. Nobody can recreate that sound. Yeah, really that. Been with psychologists who have also said the same thing. Counselors.
Yeah. Yeah, I've had a similar experience. I've gone to so many psychologists I can't even count because of course, of the associated conditions. I also have OCD, anxiety, but I'm not going to get into that right now.
I wasn't rolling my eyes at you. I was rolling my eyes at the weight of the reality of comorbidities.
Oh, okay. Okay.
Yeah, they're really heavy.
Yeah.
They say they give these percentages about how many kids are comorbid Tourette syndrome with something else, and really with the Tourette people I've met, all of them have some sort of a comorbidity.
Oh,
ADD,
yeah.
OCD, maybe a little bit on the autism spectrum or sensory disorder. That everybody's got something else, anxiety, depression, along with the Tourette. Like,
Yeah.
I mean, as far as like in my experience, I feel that the percentage should be a lot higher.
Oh, yeah. I mean, I know the statistic is that 50% of people with Tourette's have ADHD and 40 to 50% have OCD.
But how many of those
Higher.
how many of the ADHD diagnoses are based on hyperactivity, which are
Uh-huh.
really just tics? And some people will
Also,
immediately just take hyperactivity and say, oh, ADHD, when maybe that's not even the case.
yeah, exactly. Also, this is what my study is actually about, is that how many of those ADHD cases are actually a kid with sensory hypersensitivity who isn't able to tune out extraneous stimuli like the teacher writing on the board with a piece of
Or the
chalk,
lights
or the
making
lights or the
noise.
tag in their shirt, and they're not able to habituate to that. They're not able to get used to it, so they keep paying attention to it, and then they're distracted from whatever they're doing. Now,
So
is
they're
that,
like actually focusing but on the wrong things.
yeah. So how many of those ADHD diagnoses aren't actually ADHD, but they're sensory issues? We don't know.
Yeah. And
Um,
you can't really know until they're able to, I don't know, like maybe not scan your brain, but maybe an EEG that like the brain waves say, oh, this person isn't paying attention, or oh, this person is being overstimulated, or like, yeah.
yeah. Yeah, when I was in fourth or fifth grade, I was diagnosed with ADHD. Now, I don't have ADHD, and I later found out that I went on the medication. It didn't help at all, and then after a year, we were pretty positive that I didn't have ADD. And I'm, confident that any attention issues I was having at that point were caused by my tics, my OCD, my anxiety, and my sensory issues because I don't have ADD or ADHD.
Lucky.
I'm wondering, how many other kids are like that?
Yeah. That's where ADD becomes a label and not a diagnosis, because people people are always like, no, 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 don't get a diagnosis because then it's labeling your child. Honestly, if you honestly have a condition, you want that label because that label is what can help you in school if a problem occurs. If you have that documentation, that documentation can help you, not hurt you. I mean, who cares if you have ADD and they're hiring you? Like, the whole world's been diagnosed with ADD. Like, it's not going to affect your ability to get a job unless your ADD actually affects your ability to get a job. But just the fact that you're labeled with it won't change that. But like, to have a true diagnosis, it's really valuable to have that. But if it's not really what a child has and nobody's bothering to rule it out, then they really are just labeling the child for the sake of labeling the child, and it's not helping the child at all. Maybe it's not hurting them, but yeah, people get all up in a huff about labeling, diagnosis.
Yeah, definitely.
I feel as though we somehow magically wore this topic out, and we thought it was going to go on for 2 hours. I want to thank our audience for hanging in there with us with the technical difficulties. I hope this podcast has been as entertaining as our last one. But for now, we are going to say good night. Thank you from me, Shane of iTube for Tourette, and
good night from Jackie.